So you have 3 minutes to respond.
Sure. Yeah, I don't think I'll be able to kind of go through all the list, but we'll take down your question and look forward to responding in writing or whatever is the most appropriate way. I'll leave you with this comment and this thought. I think you approved somewhere around $26 million to bring Centene into town. If the numbers are right, $26 million. I would ask you to reframe this conversation a little bit differently. If we were an out-of-town company or an organization that was coming into this community and we were bringing $1.5 billion of private investment that would require $38 million investment from this group to generate $18 million in 12 years and then $5 million into perpetuity, that this organization would bring a medical school here, that this organization would bring an innovation district that would actually attract companies from all around the world, including France, that this organization would be committing $40 million to affordable housing, that this organization would also set up a fund to make sure that Black, Brown, and people from the Title I schools would have an opportunity to access this, that this organization would go into Johnson C. Smith to retool their curriculum so it set up a pre-med program that allowed a pathway because we don't have enough Black and Brown physicians in this country. That this organization would also take care of all the major behavior needs in this community. We operate 2 major behavioral health. Most health systems around the country have closed down their inpatient bed capacity. That this organization, and I know there was references to the community benefit, that the methodology referenced is actually unknown to us. What we do know is you look at North Carolina and American Hospital Association, and we are the largest provider of community benefit in the entire state, the largest provider of Medicaid in the entire state. And also, we take care of anybody that comes to the door without ability to pay. If I were to just say that you are recruiting an outside company into this, I would say any major city in the entire country would welcome that. But let me say one more thing. An organization in the heat of the pandemic, that we're still going, and thank you for referencing the doctors and the nurses, but the environmental service workers, and quite frankly, the administrators, everybody, all 70,000 of our teammates have been there on the front line for this community, keeping all of you safe, doing everything we can, exhausted. And if that's the company that you were recruiting here, that was requesting $38 million to generate $18 million in 12 years, and then you have $5 million to do what you need to continue to make improvements, I would just ask you to consider whether that's something that you would think is an investment worthy of this community. Do we have all of the details worked out? No. I think you asked how far along we are. We're coming to you at the beginning. We are 1 year into our relationship with Wake Forest, 1 year, and most systems to be this advanced and at least have this plan, typically it takes 5 years to even get this off the ground. So I understand, I appreciate all your questions. I think we are prepared to answer them where we can, but I would ask you to reframe and think about if we were an outside health system with this set of partnerships and capabilities, doing what we're saying, we're committed to the community, would ask you to consider a different framing. Thank you.